네, 좌장을 맡은 기선한 단장입니다. 첫 발표로는 WHO의 정신건강 및 물질남용 분과의 법률 및 인권부서 정책기술을 책임지고 계시는 나탈리 드류 볼드라는 분께서 여러분께 이런 기본적인 강의를 해주시겠습니다. 그래서 제목은 WHO에서 제시하는 회복개념과 정신건강정책 가이던스라는 제목으로 강의를 해주시겠습니다. 나탈리 드류께서는 사전에 강의를 보내주셨습니다. 그래서 저희가 자막 처리를 할 수 있었습니다. 그래서 여러분께서 영어로 들으시면서 밑에 한글 자막을 보시면 이해하시는 데는 큰 어려움이 없을 것으로 생각됩니다. 그러면 나탈리 드류의 기조 강연을 듣도록 하겠습니다.
Colleagues, ladies and gentlemen, I'd like to start by thanking Professor Ki Sun-wan and the National Mental Health and Welfare Commission for inviting me to present at this forum. I will focus my presentation on the World Health Organization's Quality Rights Initiative, which aims to support countries to put in place mental health policies, plans, laws, and services that promote quality of care and human rights for people with mental health conditions and psychosocial disabilities. So I'd like to start my presentation by saying that we urgently need a person-centered, human rights-based approach in mental health. It's unacceptable that still today, all over the world, we see poor quality care and widespread human rights violations against people with mental health conditions in mental health services, but also in the community more generally. So some of the pressing issues that need to be addressed include, for example, institutionalization. And here we're not only talking about psychiatric institutions where people are housed for long periods of time, but also the prevailing institutional culture that exists in services and also in how care is delivered. Another issue is the use of coercive practices, as well as the violence, the abuse, and the neglect that we see in so many services around the world. People are also denied the right to legal capacity, in other words, the right to decide over their own treatment and care. Then another problem is the disempowering messages that many people receive within mental health care. So, for example, once someone's received a diagnosis, they're often told that they cannot contribute substantially to society and so on. And then another key problem is that services continue to place much too much emphasis on diagnosis and the use of medication to manage symptoms, rather than taking a holistic, person-centered, rights-based approach to mental health treatment and care that actually supports people in all aspects of their lives. So the WHO Quality Rights Initiative was born out of an urgent need to address these issues and to promote different approaches that align with the latest human rights standards and obligations, including those of the UN Convention on the Rights of Persons with Disabilities, which is also known as the CRPD for short. So let me say something about the CRPD. This convention basically outlines the rights that all people with disabilities, including people with mental health conditions and psychosocial disabilities, should be able to enjoy on an equal basis with others. Although people with mental health conditions are entitled to all the rights in the convention, I'm going to specifically mention just a few critical rights which are particularly important in the context of mental health. So the first right that I want to mention is the right to legal capacity, which is in Article 12 of the CRPD. This article requires that people with mental health conditions be allowed to exercise their legal capacity on an equal basis with everyone else. This means that people have the right to make decisions about their treatment, but also about all aspects of their lives. For example, their financial affairs, personal matters, and so on. And what's important is that this right also means that people cannot be treated against their will, even in a crisis situation. In other words, they cannot be subject to involuntary treatment. Article 12 also importantly requires that people be given support to make decisions if they want it. And this is referred to as supported decision making. And what's important here is that supported decision making is completely different from guardianship and other substitute decision models which exist in most countries, and where healthcare professionals, families, or court appointed people make decisions instead of the person according to what they think is the best thing for the person. Another critical right that I want to mention is the right to liberty and security of person, which is outlined in Article 14 of the CRPD. So this article states that having a disability can never be used as a basis for detaining someone against their will, either when the disability is considered on its own or with other criteria, for example, dangerousness. So in other words, this right means that people cannot be subject to involuntary admission to mental health services. Another critical right in the CRPD is Article 19, the right to live independently and be included in the community. This article states that people with mental health conditions must be able to decide where and with whom they live, and they must not be obliged to live in any particular living arrangement that is imposed on them. Article 19 also requires that a full range of community-based services is provided to people, so not only in the area of mental health, although that's important, but also in the areas of social welfare, housing, employment, education, and so on, so that people can gain the skills, the income, and the supports that they need to really be able to live in their own communities. And then finally, another key right that I want to mention is the right to health, which is included in Article 25 of the CRPD. And this right requires that people with mental health conditions are provided with the same range, the same quality, and the same standards of care as everybody else, and that these rights be provided on the basis of free and informed consent. So what is clear, however, is that countries are far from meeting the standards of the CRPD. We need significantly to transform mental health systems and services if we are to fulfill our human rights obligations and also achieve good mental health and social outcomes for people using services. Reform efforts need to happen across several different areas. So firstly, there needs to be a focused effort to transform the attitudes and the mindsets that lead to stigma and discrimination and human rights violations more generally in the area of mental health. Another area is the need to provide a comprehensive system of community-based mental health services that are person-centered, that promote human rights, and also that are holistic. And then thirdly, policy and law reform is critical. They're needed to reinforce a comprehensive and sustainable rights-based approach in mental health in line with the CRPD and other international human rights standards. So as you can see on this slide, these are all areas that we're addressing as part of the Quality Rights Initiative. And what I would like to do now is to go through each of these areas and also highlight some of the different tools that we've developed to support countries in each of these areas. So let me start with the first area of quality rights, the need to change attitudes towards people with mental health conditions, and also for governments to actively invest in education and training in this area. So this is basically the foundation for any successful mental health reform in countries. In order to support countries in this area, we've developed the Quality Rights Training Package, and this package includes a set of core and specialized training modules, all grounded in the CRPD that you can see on this slide here. The modules explore many different areas. So they look at mental health, human rights, they look at the right to health, recovery, they look at ending coercion, how to promote legal capacity, how to establish supported decision-making in services, and then also they look at strategies on eliminating seclusion and restraint. And I'm very happy to say that these modules have all been translated and are available in Korean, thanks to the efforts of Dr. Seong-Soo Kim and the Jungin Who Collaborating Center. And we're also aware of the research and development project currently underway in Korea to build human rights-based intervention skills among stakeholders in Korea, which is based on these quality rights training materials. And we commend Dr. Kim and Drew University for leading this work, as well as the government of Korea for funding these important efforts. In order to extend our efforts to build capacity, we've also developed the WHO Quality Rights e-training which is based on the face-to-face training materials that I've just mentioned. So through this e-training, the idea is to be able to reach, engage, and train many more people within a shorter period of time, and also at a much lower cost than is possible through just face-to-face training alone. And here we're really talking about being able to reach hundreds of thousands of people within and across countries. So to give you an idea of the impact that this e-training is having, currently there are 113,000 people who've actually enrolled onto the course, and around 50,000 who've already received their WHO certificate. And thanks to this training, we have seen substantial improvements in attitudes and practices based on the pre- and post-training questionnaires that we've been administering. So on average, we've seen 40% improvement in attitudes aligned with reduced stigma, aligned with reduced discrimination, and also aligned with a human rights-based approach. Another key area of our work is around creating community-based services that respect rights and are person-centered and recovery-oriented. And in 2021, we launched our WHO guidance and technical packages on person-centered and rights-based community mental health services. So this guidance showcases 25 holistic, rights-based mental health services from around the world. And this includes all the different types of services, so including crisis services, hospital-based services, community centers, peer support, community outreach, supported living, and then also importantly, comprehensive mental health service networks. So a few comments about the services that we showcased in this guidance. So these services were selected because they met specific human rights criteria, including that they promote respect for legal capacity, non-coercive practices, they engage in participation, they promote community inclusion, they adopt a recovery approach, and so on. And what's also important is that each of these services was selected because it had evaluation data demonstrating its effectiveness and its acceptability. So these 25 services are basically a testament to the fact that it is possible to develop rights-based community mental health services that also at the same time achieve good health and social outcomes at the equivalent or less cost than traditional mainstream services. Also, importantly, this guidance that I've just mentioned outlines key action steps and recommendations that countries need to take to scale up these types of services. So some of the key recommendations we're making are to, for example, increase funding for the development and scale up of rights-based mental health services. And for this, countries need to look at how to change existing funding mechanisms in order to reorient funding towards these kind of human rights services. And one important action would be, for example, to make sure that national health insurance schemes cover and reimburse community services that are rights-based and recovery-oriented. Another recommendation is to establish legal and policy frameworks that are comprehensive, holistic, and aligned with human rights and reflect a multi-sectoral collaboration, and I'll say more on this in a little bit. It's also important to establish a comprehensive rights-based network of community mental health services that interface with a strong social sector. Then another key recommendation is to undertake wide-scale training on mental health, human rights, and recovery for all stakeholder groups, as is currently happening in Korea. At the same time, it's also important to integrate this training into health, mental health, and social sectors, undergraduate courses, as well as graduate courses and course curricula. Countries should also collect data at national and service level on health and social outcomes for people using mental health services. And countries should also be increasing funding for research related to community-based mental health services that are using these rights-based approaches, as opposed to just funding research around traditional mainstream services. And then finally, a very important critical recommendation is for governments to engage organizations of persons with psychosocial disabilities as advisors on policy, on planning, on law reform, on service development, and also importantly in training as well. So now let me move on to the next area of work, which is around mental health policy and strategic action plans. Policies and plans we know are crucial to scaling up rights-based mental health services, and I'm very pleased to say that we're making good progress in developing new guidance for countries in this area. So here on this slide, you can see the policy framework that we've developed so far as part of this policy guidance. So as you can see on this slide, there are 5 key areas for action. The first area is around service organization and development. And for this area, we include one policy directive around coordinated rights-based community services. And here we're talking about the need to develop a full range of rights-based services, and this includes peer support services, which so often get forgotten. Also, we're talking about the need to transform existing services, including hospital and primary care-based services, so that they are recovery and human rights oriented. And what's also critical here is to ensure that all of these different services work in a coordinated way to deliver mental health care. And then other policy directives under this service organization and development include the need for partnerships to promote community inclusion, and also another policy directive around deinstitutionalization. So another area for action is around human resource and workforce development, which includes policy directives around task sharing, around recruitment and retention, and also the development of competency-based curricula for mental health. And an important thing to emphasize for this area for action as well is the need for training to build knowledge and skills around mental health, human rights, and recovery. Then another area for action is around rights-based assessments and interventions and supports, which include policy directives around rights and recovery-oriented assessments to determine people's support needs, as well as pharmacological and non-pharmacological interventions as part of mental health care. Then another key area for action is around mental health sector contributions to addressing structural and social determinants and society-wide issues that impact on mental health. And here we're including policy directives around transforming mindsets and improving literacy, around collaboration between all sectors to address the determinants impacting on mental health. And then another is around humanitarian emergencies. And finally, we also have another directive on suicide prevention. And then the fifth and final area for action is around governance, accountability, and other enablers. So for this area, we include policy directives around leadership and accountability, financing and budgeting for mental health. And again, here it's important to reorient funding towards rights-based services and ensure that health insurance coverage exists for these services. Another directive under this area for action is on participation of people with lived experience and civil society more generally, their participation in policy, law, and service reform. And then finally, we have a policy directive on developing rights-based legislation in the area of mental health. So each area for action is obviously interlinked with other areas, and you can see that governance and other enablers cuts across all the different areas for action. Other important features that I want to mention about this guidance is that there will be an emphasis throughout each of the 5 areas for action on human rights, on person-centered and recovery approaches, as well as on participation, on making sure that we address stigma and discrimination, on changing attitudes and mindsets, as well as changing service cultures in the area of mental health. The guidance will also include key considerations related to age, gender, sexual orientation, disability, immigration and refugee status, race and ethnicity, and so on for each, again, once again, for each of the 5 different areas for action. So now this takes me to the last area that I want to mention, and that is around law reform, which is also obviously crucial for effective policy and service reform. And I'm really pleased to say that last month, on October 9th, we launched our new guidance on mental health, human rights and legislation, which we have developed in collaboration with the Office of the High Commissioner for Human Rights. So some of the key issues addressed in the new guidance include several areas. So one area is around equality and non-discrimination. Another is around personhood and legal capacity. Yet another area is around informed consent and eliminating coercive practices. There's also access to quality services, implementing community-based services. There's a focus on participation, on accountability, and then also cross-sectoral reform for holistic service provision. So these are all the different areas that are covered in terms of content for mental health law. And also importantly, the document includes guidance on the process steps that countries need to take to develop and implement and evaluate laws in a human rights compliant manner. So time doesn't allow me to go into each of these different areas, but what I would like to do is highlight some specific content areas to provide you a flavor of what law reform can look like on some of these very important issues. So first, let me look at the area of equality and non-discrimination. We know the stigma around mental health leads to unequal treatment, disempowerment, and discrimination. And one example of discrimination is that people aren't able to access good quality mental health services because in many cases, these are not covered or only partially covered by health insurance. Then in other cases, people experience barriers to accessing services on the basis of their status. So for example, in many countries, people experience barriers to services because of their race or their status as a refugee or migrant and so on. And then another problem is that people are not given the necessary accommodations and supports to be able to benefit from services on an equal basis with others. So what are some of the legislative provisions that can be put in place to overcome these issues? So first, we need to prohibit discrimination and really promote equality. We need to make sure that there is insurance coverage for mental health. And we also need to introduce reasonable accommodation measures into services. So here on this slide are some specific examples of what the law can say to address each of these issues that I've just mentioned. So for example, the law can state that all persons with mental health conditions are entitled to equal protection and equal benefit of the law without discrimination. This essentially means that people must have the same rights as everyone else. In other words, they cannot be discriminated against on the basis of their condition or disability. Another provision can state that a person with mental health conditions shall have equal access to health insurance. A provision like this can ensure that people can fully access the care and support that they need without putting them into financial difficulty. And here it's important that health insurance cover and privilege rights-based community mental health services specifically. The law can also state that a person using services will be provided with reasonable accommodation for the exercise of their rights. So when using services, reasonable accommodation could be, for example, that people are offered access to supported decision-making, or that they're allowed to take someone into a medical consultation with them to support them during the consultation. So moving on to another really important topic, which is the topic of informed consent and eliminating coercive practices in mental health care service provision. So some crucial challenges here around eliminating coercive practices include the fact that rates of involuntary hospitalization and treatment continue to rise, particularly in high-income countries, while restraints, unsanitary living conditions, physical, psychological, and emotional abuse are still hallmarks of many mental health services across the world. So as a solution, law needs to tackle and reverse this situation. And in doing so, it's really important to establish in law the possibility for a number of different provisions. So provisions, for example, in the need to promote free and informed consent to treatment, for access to supported decision-making, for advanced planning, and also importantly to support people, to be able to support people during a crisis. So what can the law say in the area of ending coercive practices? So one thing that it can say is that free and informed consent should be required before any mental health intervention or treatment. So this means that a person has the right to understand what the treatment involves, its potential benefits and its side effects. It also means that they have the right to freely choose whether or not they want a specific treatment or care. The law can also specify that access to supported decision-making is provided to people to help them make decisions about their health and medical treatment. Again, this is very different from substitute decision-making, where decisions are made on behalf of the person. As a reminder, in supported decision-making, the person remains at the center of the treatment decisions and makes the decisions themselves, but can receive support in doing so. The law can say that every person has the right to make advanced directives with regard to healthcare interventions. Again, this is a very important thing that law can do. Advanced directives are an important strategy for eliminating coercion because they allow people to indicate very clearly and categorically what treatment and what support they want or they don't want. Another important thing that the law can say is that it can state that community-based crisis support services need to be made available and adequately funded. So crisis support services can include, for example, a mobile crisis team who can intervene in a crisis situation and whose members have the expertise to be able to de-escalate a crisis situation. Other crisis services might include, for example, peer support services specialized in crisis, or crisis hotlines that people can ring, and so on. Another key area for law is implementing mental health services in the community. We know that still today, institutions are the main kind of mental health services in many countries. This is despite the fact that they are associated with isolation, with exclusion, with wide-ranging human rights violations in general. And the lack of community-based service alternatives means that people continue to remain locked up in these facilities, unable to live a decent life in their own communities. So again, here, law has an important role to play. It can promote deinstitutionalization. It can push to reallocate financial and human resources away from institutions and towards community-based services. It can also support the development of services that are person-centered and rights-based. And then also, importantly, it can ensure that people with lived experience play an integral part in providing the mental health services. So some of the specific examples of what the law can include in this area include making provisions for creating a multi-sectoral commission to develop and implement a policy for deinstitutionalization. So obviously, deinstitutionalization is a complex process that needs to be well organized in order to be effective. And it really requires a coordinated process, including the development of very carefully worked out plans. Another critical area that law can include provisions on is that health authorities should reallocate budget towards community mental health services. Again, here, what's important is that the budget should be allocated specifically to services that promote human rights and a recovery-based approach. And then finally, legal provisions can also promote and support peer involvement in the provision of mental health and related services. So people with lived experience have a critical role to play in delivering mental health services. They bring understanding, they bring trust, they bring hope to the service. And so the services become much more acceptable. But peer support services often don't get the funding due to a lack of awareness of their effectiveness and how important they are. So law can really help to ensure that they're made available and that they receive sustainable funding. So this brings me to the end of my presentation. I hope I've been able to provide you with an overview of WHO's work in this area and give you an idea of some of the tools that are available that we've developed to support countries in mental health policy, service and law reform. We encourage you all to access, use and disseminate the different quality rights guidance and training materials that I've presented. As I said, many of the training materials are now available in Korean, and we're very pleased that they're already actively being used in Korea to build capacity of national stakeholders. So we encourage you to continue on this positive path towards building more inclusive, supportive and rights-oriented services for people with mental health conditions throughout Korea. Thank you very much.